Friends, I am Dr. Amdekar. You must have watched our last 6 videos related to pain where my colleagues discuss several issues relevant to different sides of pain. In this video, I am going to focus on the challenges caused by the pain that presents to us and the evaluation of such a pain. First and foremost, please remember that pain is a very subjective symptom and there is no objective measurement of pain. And it varies so much with individuals, and it all depends on attention, expectation and tolerance of a given individual. Having said that, severity of pain is almost impossible to judge objectively. Also remember that children under 5 years of age cannot even localize the site of pain, and therefore the pain may be manifested by irritability or crying, and one may not be sure whether it's a pain or any other problem leading to irritability. Having said this, what about the problems posed by defining the site of the pain? When the patient presents with abdominal pain, be sure that it may also be caused by a lower lobe pneumonia coming from outside the abdomen because of a diaphragmatic pleural involvement. When you talk about headache, you are aware that the headache may be extracranial and it could be sinusitis or a dental pain, and the patient may come also with trigeminal neuralgia, and the headache again is not easy to define where is the site of this site of pain. Going further on the joint pains, we are all aware that in chronic arthritis, it takes time to label what kind of chronic arthritis it is, and it takes several weeks or few months before you can label definitely whether it's a juvenile idiopathic arthritis. In other words, you will have to watch carefully for any associated symptoms or of course signs. When it comes to chest pain, don't forget that it could be extrathoracic as well. An adolescent girl coming with some chest pain could be just a developing breast causing discomfort to her, whereas an intrathoracic pain could be not only cardiac but esophagus pleural reaction, and when it is cardiac, it may not be myocardial infarction alone, but it could also be caused by other cardiac conditions like an aortic stenosis or a hypertrophic cardiomyopathy. So friends, even site to define correctly is a challenge by itself. When you talk about backache, unfortunately the prevalence of backache is increasing even in children, but of course it's very common in adults, and it is for varieties of reasons. It could be simply a muscular pain, or it could be something sinister, and today's lifestyle of usually older children or adults is they carry a lot of load on their back, their postures are not right, and therefore even backache may not be sinister always in terms of a cause. Having said how difficult it is to define anatomy itself, it poses a challenge. What about pathology? The common cause of pain is inflammation, but friends, inflammatory pain generally has also accompanied swelling, redness, tenderness, fever, but some of the inflammatory causes of pain like esophagitis or a pleuritis for example have neither swelling nor redness nor fever, and you will have to decide based on many other associated features whether it is still an inflammatory pain without other attendant symptoms of inflammation. When it comes to beyond inflammation, for example a vasogenic pain has to be guessed by the accompanying situation in which you are seeing a patient. For example, if you have a patient who is just recovering from dengue fever and while recovering he suddenly develops a severe acute abdominal pain, it could be a vascular pain, and this could be an early onset of shock where intestinal ischemia is the cause of pain. Similarly, a vasculitis intra-abdominal caused by an IgA vasculitis, earlier known as henoch-Schönlein purpura, may come with severe abdominal pain, but purpuric spots on the skin may appear few days later, and an abdominal pain may be the only presenting feature. That's how it could pose a problem to define correctly, but generally the vasogenic pain is a very acute. And so also the neurogenic pain. For example, an adolescent or an adult who is suffering from diabetes could develop a diabetic neuropathy in the intestine and cause severe abdominal pain, again posing a problem. There is no other way to judge such various pathologies but assess in details the associated issues along with the pain. Having said this, that the anatomy and pathology both seem to pose challenges at times, and we go one beyond that, and the biggest challenge today is a functional pain syndrome. Friends, even in children, almost 20 to 30% abdominal pains may be functional. And there are many functional pains that you see at all ages. For example, an irritable bowel syndrome is a functional disorder. A tension headache is a functional disorder. And fibromyalgia is a functional disorder. Now, how do you pick up such a pain to be functional? There is no evidence objectively by any laboratory test. So do you mean to say that a diagnosis of functional pain syndrome is only possible by exclusion of all other organic causes of pain? Well, that is very irrational to my mind. So do I have to say that we can suspect a functional pain to begin with itself? And my answer is yes. Well, there is a limit to suspect a functional pain to begin with. But friends, if the kind of presentation of pain does not suggest any danger to life, does not suggest a potentially dangerous situation, then it is always best to wait for a while and get into more details, and I am sure there would be an occasion where you could even suspect a functional pain. For example, there are some characteristics of functional pain. A patient with functional pain is very vocal. He gives all minute details about his pain as if to impress on the doctor how serious is the cause, and he has been often suffering very often. But what is most important for any functional disorder, that the presentation of such pain is at the most convenient time to the patient. For example, an adolescent is happy when he is with his friends, he is happy while playing, he is happy partying, he has never got up out of deep sleep with pain. That pain has never bothered in terms of his weight maintenance, his appetite, his activity, his energy, but even then he claims to be suffering from pain. Well, you do get some possibilities in your mind that it could be a functional pain, and as I say it again, if there is no danger on waiting for a while, one could even consider very rationally a probability of a functional pain and not get on to investigations for no reason. Having said that, you have even children coming with functional pain, especially the older children, and adults of course too. And today all such problems are on the increase because a typical functional pain is something that has no clear structural or biomedical cause that is evident. However, I have already said that rationality demands a suspicion even at an earlier stage. Well, the causes are of course hidden, but many times it could be anxiety, stress, insecurity, depression, and whatnot. It's not easy to pick up such etiologies either, but as I said that it is possible that you can suspect it. But don't forget that sometimes even an organic etiology may have an overlap of a functional pain, and that is very challenging. And rarely the pain is a fake pain. Well, functional pain is a genuine pain that the patient suffers. but sometimes the pain is fabricated for own purpose, either attention seeking or for any materialistic gain. Friends, please note that pain is a challenging symptom, and as I mentioned, it certainly poses some problems that I have discussed. I hope you are enjoying this series a great deal. If it's a functional pain, it is best treated by the team. It could be really boosting up of the mind, making it strong, medication, biofeed mechanism, and rarely also some pharmacotherapy if required. I hope you have been enjoying this series, and we have come to the end of series on pain, and our next series starts with a cough, and next video will be discussed by Dr. Chokani. The cough is a distress to the patient but a problem to the physician. I hope you continue to be with us. Thank you very much.